The plight of Maori children and youth is improving, but there's still much work to be done in the field. That's the recent discovery of local researchers from the University of Otago's New Zealand Child and Youth Epidemiology Service. And Acting Director Dr Mavis Duncanson joins us to talk about it. Good evening.
Good evening.
How are things getting better for Maori children and youth?
Well, there are a number of indicators in our report where there is improvement. Just a few. There are now a higher proportion of Maori children are immunised, and particularly at ages 12 and 24 months, there's really very little difference between the proportion of Maori and non-Maori Pacific children. We have a wonderful decrease in the number of Maori babies dying in the first year of life, and that's the sudden unexpected deaths in infancy, and so that again is a major improvement. For our young people, a lower proportion are smoking in year 10, which has been a dramatic fall, and we've also got young people staying longer in school and a greater proportion achieving NCEA level 2.
In what ways are they often at a disadvantage?
What we also see in the report is that there is still continuing inequity in the exposure of Maori children to those determinants of health that are so important. Things like household income, safe, secure housing, access to food and material hardship.
And how do those things affect their health?
So one of the indicators which is not going in the direction that we'd want is hospitalisations for conditions that we know are related to the conditions in which children are being born and growing up. So particularly hospital admissions or hospitalisations for respiratory diseases, communicable diseases, things like that.
What are some of your key findings?
I think that the key findings are both that the great achievements that are being made at an individual level with organisations both in the community and government agencies obviously investing in improving outcomes for children, and I've talked about some of those. Another one is actually enrolment in early childhood education, where again there's been a big increase in those enrolments. But what we do also see are those persisting gaps between the experience of non-Maori, non-Pacific New Zealand children and Maori and Pacific.
Have the findings been a surprise?
Not a surprise, sadly, because this is the kind of thing that we've been seeing. It's been great to be able to monitor and track changes in a positive direction, but I think there is some fundamental change that needs to happen in order to address the continuing inequity.
What are some of those fundamental changes?
I think the Maori Affairs Committee back in 2012 put it really well, and it's the things we've talked about. Having secure family incomes, having safe housing, having access to nutritious food. You are probably aware that late last year our government, alongside other member states of the United Nations, signed up to the Sustainable Development Goals, and the first two of those are eliminating poverty in all its forms and eliminating hunger. And I think that's something we need to work on in terms of how New Zealand will achieve those goals.
Why is inequality still a big problem?
The World Health Organization kind of says that, or not kind of, the World Health Organization says very clearly that inequity in health is largely the result of the way that societies are ordered, and that it is possible for countries to make decisions that will reduce those inequities.
We look forward to further findings from your study. Acting Director of the University of Otago's New Zealand Child and Youth Epidemiology Service, Mavis Duncanson, thank you very much for your time.